Hello everyone, welcome back to my channel. Today I'm going to discuss about public health and biostatics. I have seen few of you have been asking me what are the things we should be doing for this subject for MCC QE1. As you can see on the slide that today I'm going to discuss the resources first and second thing how to use those resources. For sure our MCC website is the most important thing to refer back and see where we are. But in terms of getting an information and increasing your knowledge to perform well in the exam, these are all the resources which I'm going to use. Before I move on to the resources, I just want to mention you this subject or this portion of the exam won't be coming for extensive level. Definitely there are few questions, there are minor portion of the exam will be coming from this one. If you really think you want to get the best score or you want to get the highest score, then I think you should work on this subject because it will help you to gain the score more. And second thing is few people who really thinks that they can get wrong in other subjects for xyz reason. Doing this part will help you to go from less score up to the pass and getting the passing score. So I think it's a worthwhile to work on this, learning about this and trying your best to get an idea and grip on the subject. The one thing which before I forget to mention, if you are reading or trying to remember the formulas, don't just read for a day. I think the best idea which I have done for myself was putting the white sheet on your wall in front of your table. Write down the formulas, and when you're writing the formulas, make sure you are understanding the formulas, because you can remember the formula, but the problem is when you get a statement, the numbers or the digits which was given in that questions, you have to understand where should I put into the formula, because you can do a calculation very easily, I'm sure. Are you when you are doing an odds ratio, are you putting the upper denominator and numerator the exactly same what they are looking for, or you are putting other way around? So I think that's the one important thing when you try to learn and remembering those formulas. Make sure you understand what should be the coming top and what should be the coming down, so that can help you to calculate and get the correct answers. Without wasting any time, let's get started with our resources. I'm going to share some of the things here. Number one thing is MCC website, which is probably the most important things we have seen for our QE1. You can see these are all the topics for the public health and its determinants, which you have to understand and learn and remember for your QE1 exam. And these are the index of the Toronto notes page, and I tried to put some of the highlighted parts which I feel are very correlated to what the MCC objectives are saying, and you can read all of these topics. I'm not saying that you should not read these things, but I think the highlighted part should be the first one. You have to read it and you have to remember it. If you want to go one by one on each of them, you will probably correlate that how they are talking about this one. Let's suppose if I'm going to the occupational hazards. Occupational hazards means when you're working at some place, there are particular hazards which are can be prevented, which can be managed. So that's the one thing. So we can go to the work related health issues. If you go to the work related health issues, you will find all of these hazards, and if you go on this topic, you will probably find most of the things available in the Toronto notes. So I think for other things, it's a very good way to start with the Toronto notes. If you can memorize and understand and everything from the Toronto notes, go for it. You don't probably have to jump to many resources. But one of the important resource which I have did for my preparation when I was trying to learn was this one. This website, I don't know how many of you are familiar with this website, or anybody had tried to read about this, but I had read this website almost a 50%. Why I'm saying 50%? Because I skipped the things which I feel as unnecessary. This website is very big. It's very, very big. The only thing is you have to pick and choose. AFMC Primer for on public health. I think this is the book which Canadian graduates use during their med schools when they have to learn about this subject. The best part which I feel about this this website is they already give you a lot of things that why they are talking about these things, because they are coming into the MCC objectives. Now if I go back to the MCC objectives, probably these things has been changed from the last few years. There has been some additions and some modifications. If you want to go back to here and say, oh, I don't see these things, probably some of them are not there, so it's okay. You can read the things which are available here. Let's talk about how to read this one. If you go from here to down, it's a lot. I know it's a lot, and it's a lot to say that you can read it 50% of it, but believe me, this one is written in a very simple English, in a very easy way that you can just learn like a novel. You don't have to remember things. One thing which I have seen is all the figures and all the tables which are given are very much giving you the summary of the whole paragraph. So I think if you are talking about this paragraph and it's like, oh, I need to go back and see what the disability looks like, what the impairment looks like, what the handicap look like, you don't have to. Just read this one more time and you're good to go. So you have to just do that part. In terms of this whole website, I won't say to read everything, but I would say read few of these kinds of figures and diagrams. Also read some of the things which gives you the definition of that part. You don't have to do these questions, you don't have to do all of these nerds corner, it's an extra information, you don't have to do that part, but try to do some of the things which is important. Let's get back to the next page. Impairment, disability and handicap is a very important topic which you need to understand. What is the difference between all of these? Health, wellness, illness, sickness, disease. I think when we talk about illness, sickness, disease, we always see a sick patient, a patient. But what is the difference between all of this? You have to understand this parts. The one of the most important thing which I would like to emphasize is the chapter which includes the studies, observational studies, cohort study, case control study, RCT. So I'm going to see if I can find that one now. Yes, I'm here. So when you see this one, it's a lot. I'm saying again and again, it's a lot. But what I mean by that is, if you read, if you learn, if you remember these things, you will be going from fail to pass, or you will be going from 240 to 260 score, or 260 to 280 score. So I think that 20 numbers really worthwhile if you read this and you get the good score. So if you are going down here, there are lots of things which you have to remember, because bias, confounding, maybe sometimes these things doesn't make a good sense. Try to manipulate your mind and see what the wordings looks like and why they are telling about it, what are the things we need to know. So that's one of the important thing. The other thing is, when you go on any of these studies, you will find these diagrams. These diagrams are very important, because when you are doing any kind of formula calculation, you should be putting your own statement into this figure first of all. Let's suppose if you say there is a 50 patients in a community which are without disease, 40 of them were exposed, but 10 of them were non-exposed. But when you see their ratio after 10 years, you find out that 40 of them who were exposed, only 20 of them got disease, 20 of them did not got the disease. But the 10 of the unexposed group, 7 of them got the disease, 3 of them did not got the disease. So what I did is I just put these boxes and completed this part. Now our next target is to figure out what are the formula they are looking for, what are the question they are asking for. And I ask you, can you calculate the relative risk of this exposed or diseased group? When you put this 2 by 2 table, you will literally understand what I'm saying, because when you see this exposed or risk factor present, that means the peoples who are exposed, which were 40. But what you need to do is, you need to do with the diseased present. That means 20 of them had disease, so you just put the 20 here. And exposed group but no disease was 10. So 20, sorry. So then you'll put the 20 here. So then you can find out what is the relative risk formula is. And if you remember this formula, that's nice. But if you remember how to put these numbers, that's excellent. Second thing is exposure or risk factor absence. That means the people who were 10 in numbers. You remember I told there are 10 people who are unexposed, but 7 of them got disease. So you're going to put the 7 here. And what is remaining? 3 remaining. So now you have your A plus B plus C plus D. All of these things are available, and you just put in here and get your relative risks. It just takes you 1 minute, but once you know the concept, this is one of the important thing I will say you have to understand. And this goes backwards. So when this goes backwards, what they ask you for? Odds ratio. And second thing which I feel like is you have to understand which study can do which formulas. Relative risk can be done in cohort study, because cohort study is going perspective, means going towards the forward, towards the future. But if you go back to the case control, they are going retrospective. They are looking at the previous background of the patients, they are looking at the previous record. So they are talking about odds ratio. And why we have biases? Because when you consider, let's suppose you want to consider 10 years back, the population in one of the provinces had the exposure to the smoking, and you want to talk about the lung cancer. For those community, maybe there are 500 or 600 community peoples, but you can only get the results, or you can only get the documentation of 70% of the community, not the 30%. You cannot find the 30% of the documentation. So that is we call the biases. These are the things which are basically maybe an error which is happening because of situation, or maybe an error because of a bias. So these are the things you have to understand. And confounding and other stuff, I think they are very important. I would say if you are not able to read all the chapters, I think you should be reading this chapter. Is very important, because this gives you formula, this gives you concept, this gives you a question of at least to solve in your exam. Screening is definitely one of the important thing. You don't have to read the whole screening. Why we do screening, what is the sensitivity and specificity. I think 80 to 90% of you probably have some kind of mnemonics in your mind, but I feel like remembering this is very, 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 very important. I would very highlight on this part. Read that part. If you talk about identifying the hazards, this is the same one which we were talking about, the workplace hazards. So you understand what I was saying is these are all the hazards which is at the workplace. So I think read this one or read Toronto Notes. It's really up to you. But if someone wants to use this website and they want to use the website, then I think I have given a little bit of idea how to use this website. These kinds of figures and diagram probably you will see in each and every chapter. I think at least go through these ones and make sure you read the paragraph before and after that one, because these paragraphs are exactly the same. So you will be reading everything twice and you will be remembering more easier. In terms of few topics from the objectives, I have seen that these topics are not available in this website. So what I did is I just get an example: quality improvement and patient safety. Before I move on, I just want to show you that you will find the quality improvement and the patient safety. I think it's a quality improvement only, the quality improvement topic in the Toronto Notes. But what I understand about is CMPA website has a very nice topic about this one. So I think doing this one is very nice way to gather all the information. Just write the Google quality improvement patient safety CMPA and you will get back to this page easier. At the end, I would say try to find out what are the MCC objectives you can revise. Number 2 is, if you are good in Toronto Notes, go for it. You can do that. I'm not saying that Toronto Notes cover everything, but if you want to read the whole chapter, that's very good. Second thing, using this website will give you all the ideas how the MCC objectives looks like. Third thing is, when some of the topics are not available in Toronto Notes and some of the things are not available in the website, you can still use the CMPA website or any other resources which is Canadian based to read about that topic. Biostatics and public health is not something you cannot do. The only question is how much you want to do and why you want to do. I think it will give you an idea that it's very important that you read few of these resources, talk about the formulas, talk about some preventions, talk about some studies part. I hope this video helps you a little bit about, and I'm really happy to answer any of your specific question. Please subscribe to my channel. Let me know if this video helped you and if you wanted me to specify or maybe answer some of the specific questions in your mind. Thank you so much and have a great day.